we've been using since 2000. Actually, since 96 in this country, but it was FDA approved in 2001. And this is the Realize band, which has been used in Europe since the same time frame. Like, both the bands were created in the late 80s. One here, one in this is a Swedish band, so in Sweden. And this band was FDA approved in this country in 2007. We're doing both bands. They have different websites. There's a lot of support on the Realize band website, and Tammy can give you that information when you call in, and you can check it out. The Allergan band is just, we've put a lot of those in over the years because it was what was available to us here. Both the bands work the same. There have been different studies looking at which band is better. And when they did a meta-analysis, so they lumped all the Swedish band blocks or the Realize band, and they lumped all the left band together, their outcomes were very similar. And there's not a better band, it's just a band that you like. So again, that's why I say Coke and Pepsi. It's, you know, you don't like Coke or you like Pepsi. You know, some of you don't drink cola, we can do it Sprite and 7-Up. Okay. And this is an animation for the band. These are the small cuts that we make. They're not in exactly the same places. When you get an animation, which costs a lot of money for free, you just take it how it is. And it cuts inside. There's the stomach. Okay, it's going to cut away, cut the chitlins away, and then the band goes in. This is a very simple procedure for us to do. It takes about a half hour to an hour, depending. And then that band gets connected to a port that goes under your skin. We access that port in the office. And we put in not blue stuff, but saline, which is clear, but this is for the animation to show you what we're doing. And that saline blows up the balloon and cinches around the stomach. And she's passing around the Realize band and the Allergan band. The Realize band has that beige port, and the Allergan one has the white one. Oh, you guys can't sell these on eBay, so please return them to Tammy or just make sure they go all the way back. We've had a couple. I had one disappear when I was giving a talk in Lennox-Hill too, and all of a sudden I'm like, where's the band going at? And so I was like, I don't know why would anybody want it, you know? But then someone said eBay. I was like, oh, I should check, maybe it's there. Okay, so without the band, the food's coming right through, okay? With the band, those little particles are hanging out, but I have an animation of that too. Let's see if this works. Okay, so if you watch this here, the fluid's going in, there's the band tightening, and it's stopping the fluid. As the fluid comes out, the balloon opens up and the food particles shoot through. Obviously, we should have done that in reverse, right, to show you it tightens and slows the food down, but this is what I have. We're going to work with it. Now, there's a picture of the band where the balloon is not all the way across. I look at that balloon being all the way around, a significant improvement, and that's why it's a gentler band. And I think also will affect our erosion rates, but I won't know that for another year or so. We've been doing it for well over a year with this particular band. So we do adjustments basically to see if you're hungry. If you're able to eat big portions, we tend to give you a tightening, and we do it through the skin with a needle into that port in the office. Now this is the flat band system, and you guys have that there. This is it open, and that's it blown up. The advantage, there's no intestinal surgery. You can have a perforation or a leak with the left band. It's extremely unusual. It's much, much less than, it's probably about 1 in 5,000 with the left band. Versus, you know, I told you around the country it's 1 to 2% for the vodka. It is adjustable. If something happens and you don't like your blood band anymore, or there's a problem, because it is a device and so things happen, and I'll get into that. But if we take it out, here basically your stomach is unchanged. There might be a little extra scar tissue, but we never divided any of the blood supply or the nerves, so it squeezes normally. And it has the best safety profile, the lowest risk for any of the surgeries that we have. Now, it does need more commitment from the patient, you know, as some people just want to do a little bit of whatever they want. And some people it works for, but most of them it doesn't. You really have to still watch and make healthier choices, but it will definitely have you eating less. We do see you more often, So if you don't like to go to the doctor all that often, we see you every month for the first year, just about. And then the second year it's every 2 to 3 months, and then about every 6 months for the rest of your life. All of these weight loss surgeries are, we feel, lifelong. I've told my patients that someday I'll retire from surgery, and I know that they're going to be knocking on my door for the follow-ups, and that's okay. I'm good with it because I have a great practice, and I like my patients. But it is a lifelong commitment because, especially with the band, you have a device in you, and who knows it better and what to expect and what symptoms you're having than your surgeon. With the bypass and the duodenal switch, there are a lot of malabsorption issues, and there's potential for nutritional problems, so that you do need to follow up with your surgeon as well.
Can I ask you a question?
Yeah.
Why would someone do the gastric bypass over the bypass?
Some people, you know, it is all how you feel about a thing. I lay out the facts. I don't pick one or the other for a patient. You know, I think what I will say about the band, it works for 80% of the people. 20% of the people do not lose enough weight with the band. But of those 20%, only 5% are having the band taken out and converted to a different procedure or just having it taken out. The other 15% are just living with what they got and what in terms of their weight loss. So if someone had 100 pounds to lose, what do I mean by they failed? So 20% of those people are going to lose like 30 or 40 pounds. Of those people who lost 30 or 40 pounds, 15% of them are thinking, I didn't gain 30 or 40, I don't think it's a terrible failure, I'm willing to live with this. Now, you guys, you know, you're like, well, I wouldn't go through surgery for 30 or 40 pounds, but, you know, once you're there and you're living it, you know, maybe they're settling for a lesser outcome, but to them, they're healthier, their blood pressure may be better, their diabetes may be gone, and they're able to maintain their weight. So when some people hear, you know, 80% of people do well, but 20% don't, and they know how many diets they've been on and what they've tried in the past, they may go for a bypass because there's more of a guarantee. Initially, you will definitely have more weight loss with a bypass initially, but maintenance is really the key, and that's where, you know, talk like this, going through the different benefits and the risks are important, but it's also the support system, and you have to come back and see a doctor. I mean, every year I see a few people that I haven't seen in a couple of years. When they come back, invariably, not always, but they're up about 20, 25 pounds. Some of them are up a little more. Some of them have come back to see me because they're up a fair amount. I mean, I've had people lose 200 and 300 pounds with a bypass, but then they gain back 85 and they feel ashamed. And I'm like, you lost 200 pounds, you gained back 85, you're still 115 down. We can work on losing maybe another 20, 30 pounds. Long term, it just comes down to, you have to, and this is not your question, but long term it comes down to you have to watch what you eat.
How does somebody gain the weight back with bypass if there's no area?
Because you're able to eat more. Because that outlet, when I make it, that hookup of the stomach to the intestine, the hole that drains the food from the stomach into the intestine is about the size of a nickel. And with time, it gets bigger. It gets to be about the size of a lemon, a small lemon, so that it becomes like a pipe. So the food goes in and shoots right out so that you can still eat more. And so the first year after a bypass, and with the band, you have a constant reminder, hello, the food's not going down. But for that first year with a bypass, you really have to sort of learn that I'm not going to just eat the food because it's in front of me, which everybody does. And I don't mean my patients, I mean everybody. I do. If food's sitting around, I'm going to pick, I'm going to do, you know, and I might not be hungry. That first year is a time to learn I got to step away from that plate of food when I'm done. And then that second year, unfortunately, that's usually when you start seeing that the bypass is open, you could eat a little more, and you have to really train yourself to eat healthy and also try to maintain the portions. What I was going to get to here is that it is easy to cheat the banding because you can get softer foods in, and unfortunately the softer foods are foods that have higher calories. Well, it's softer foods, ice cream, chocolate, cookies, cakes, pies, they all slide right through. Potato chips do, because of the grease in them, they slide right through the band generally, because you chew it well enough that it'll slide through. Mashed potatoes, really great, all the comfort foods, really great stuff, make you feel good, but they slide through your band, and unfortunately they generally have higher calories, and more unfortunately bread and mashed potatoes do not have any nutritional value whatsoever, but they taste good.